my name is Claudia and I am a gynecologist. I work in a women's care clinic and I treat medical conditions and diseases that affect the woman and female reproductive organs. I am also trained in obstetrics, in which I work with mothers during their prenatal development. A symptom that I have noticed that women are going through is menorrhagia. This has been a common complaint in our clinic, and about 5% of females are seeking medical attention. The main symptoms of menorrhagia are excess bleeding in the uterine. Interval between each menses is less than 21 days and lasts longer than 7 days. What I have prescribed as treatment is non-steroidal anti-inflammatory drugs such as Advil, Moritin, Tylenol, etc. to help reduce the menstrual blood loss. I have also prescribed oral progesterone to help any hormone imbalance and reduce menorrhagia. Depending on the patient and their condition, some would take up to 10 days for the progesterone to kick in and reduce the bleeding, and some might be more severe that they would require a dilation and curettage to treat bleeding. A patient that shall not be named came to our clinic due to symptoms of menorrhagia. This is a woman who is 28 years old, Caucasian, middle class. She has a medical history of asthma, signs of depression, and migraines. She also doesn't have any past surgical history. Patient's history shows that the woman and her family always had heavy menses but were never evaluated or diagnosed with any medical condition. Her genital exam was normal and didn't show any external or internal lesions. I recommend that she take oral progesterone to reduce heavy bleeding. I recommend that women who are going through menorrhagia look at their family history to see if heavy menses is genetic. Once they go to the gynecologist, they can have enough information for them to explain their background history, and their doctor can prescribe the correct treatment for them. Menorrhagia isn't severe, but it can be uncomfortable to the woman who might undergo these symptoms. As doctors, we need to have enough medical information of the patient to provide any feedback and provide the correct treatment for them. Each patient may have a different scenario of menorrhagia, and it is our job to prescribe them the treatment that they need. In many cases, we might diagnose a patient with menorrhagia and send them home with a prescription or treatment plan, and we might overlook any other health issues. In some cases, we've had patients diagnosed with menorrhagia which have also been diagnosed with hypothyroidism. Hypothyroidism is also linked with breast cancer, which means that when we diagnose a patient with menorrhagia, they might have hypothyroidism and breast cancer. There hasn't been enough research to tell us as to why these three are connected, and as health professionals, we can work together to find an answer.